Hello and welcome to Challenge channel. In this course, we will show you how to conduct pediatric clinical examinations in easy and simple way. Actually, clinical examination in pediatric is very easy and simple. We just use head-to-toe assessment of the child. I mean by that, we start our examinations by head of the child and we end by the toe of the child. But before we start the examinations, there is a certain principle that we should apply in any pediatric clinical examinations. The first principle, we should use a wide mnemonics, in which W stands for wash your hand, I stands for introduce yourself to the parent of the child, P stands for permissions and positions. I mean by that, you should take permission from the parent, not the child, and you should put the child in appropriate positions for examinations. E stands for exposures. The second principle, you should come on the right side of the patient. The third principle, before you put your hand on the patient, you should ask about the pain. The fourth principle, at the end of the examinations, you should thank the patient and cover him. The fifth principle, you should comment on general look of the patients. You should comment if the child is well or unwell, conscious or not, distressed or not, and you should comment if there is any apparent dysmorphic features. The sixth principle, you should take anthropometric measures and plot them on central chart. The seventh principle, you should measure the vital signs, which are pulse rate, blood pressure, temperature, and respiratory rate. In the exam, you don't need to do 6 and 7 principle. Just say it by your mouth. Okay? You can say to examiner, I would like to take anthropometric measures and plot them on central chart, and I would like to take a vital sign. If you apply this principle, you will get 13 marks out of 40 in checklist of the exam. We will start this course by neonatal examinations. First of all, you should apply the previously mentioned principle. Then we start a head-to-toe assessment. Firstly, we will start with head of the baby. We look for any birth injury in the head like a cephalohematoma, which is a subperiosteal bleedings, and we look also for caput succedaneum, which is a serosyngus subcutaneous fluid collection with poorly defined margin. I mean by that, it involves all head, unlike cephalohematoma, which is defined to only one side of the head. Then we palpate the sutures and fontanelle. When we palpate the sutures, we should say its name while you palpate each one. This figure shows the name of the suture. When you palpate fontanelle, you should comment on size and shape of the fontanelles, and also we comment on molding, which is overlap between bone of the sutures. After we finish the head, then we come to the eye looking for pallor, jaundice, conjunctival hemorrhage, and red reflex by fundoscopy. There is a lot of causes of absent red reflex in the neonate, which are retinoblastoma, cataract, which can be due to galactosemia, or congenital due to torch infections. In this photo, we see absence of red reflex in the right eye and normal red reflex in the left eye. After we finish eye, we come to the nose and ear. In the nose, we look for congenital abnormalities and we check patency by NG tube or spatula. We know the patency of the nose by NG tube by trying to pass the NG tube through the nose. If we are able to pass the NG tube through the nose, this is mean the nose is patent. And we know the patency of the nose by spatula by putting it in front of the nose. If we see a vapor or steam in the spatula, this is mean the nose is patent. Then we come to the ear, looking for ear bit and ear tag, which they have a very important association. They associated with congenital malformation in the kidney. This photo show the ear bit and ear tag. Also, we look for low set ear. Okay, the question is how to know low set ear. Well, we know the low set ear by drawing a line from inner canthus till we reach the ear. Normally, 1/3 of the helix of the ear should be above this line. This is inner canthus of the eye, and this is a helix of the ear. Okay, let's take an example. So, in this patient, we draw a line from inner canthus till we reach the ear. As we see, the ear helix is found below this line. So this means this patient has a low set ear. And that's it for today's video. In the next video, we are going to complete neonatal examinations.
That's it for today's lesson. If you have any questions, please let me know. Thanks for watching. Don't forget to like this video and subscribe to our channel in order to get more and more free videos on the time of production.